should be screened for osteoporosis? Everyone should be screened for osteoporosis at certain ages, because as we age, we are definitely at increased risk for fracture. All women 65 and older, and men 70 years and older, whether they have risk factors or not. Now, there are conditions, medical conditions for men and women under those ages, and I'll give you an example of some of those conditions. Do they have a strong family history of a mother or father who have had a hip fracture? Are they on some high-risk medications, such as prednisone? Or do they have another disorder, such as rheumatoid arthritis or diabetes, or other medical conditions that would make that an increased risk of fracture? Do they have a personal history of what we call a fragility fracture, meaning they had a fracture as an adult from standing height, for instance, tripping on the curbs of a street, or just fell and broke a wrist or a femur or a leg? There's certain high-risk medications. Many women, for instance, are on anti-estrogen medications called aromatase inhibitors, and many men are on anti-androgen medications for prostate cancer, the women for breast cancer. Those are all medications that can adversely affect one's bone health and strength. Steroids. So we take a detailed history of people's medications. We take a detailed family history, personal history, and try to come up with if there is a risk factor that one should have a bone density younger than age 65. One clear example is a menopausal woman who chooses not to go on hormone therapy that can prevent bone loss, yet they have a mother or father with a hip fracture. They themselves give a history of having a eating disorder and losing their menses when they were growing up. So that is the kind of person that at or around menopause should definitely have a baseline bone density to see where they're beginning this process, because many menopausal women will lose even up to 20% of their bone mass in the first few years prior and during the transition to being postmenopausal. Some other risk factors why men and women should have a bone density younger than 65 or 70 would be if somebody has too much alcohol in their diet, or they are an alcoholic, somebody who is a regular smoking history. For sure, smoke has an adverse effect on bone health, and many women and men who smoke have very low bone density, and they should know that younger than age 65 or 70. And another important risk factor is very low bone mass, especially in women, often associated with eating disorders. But there are certain ethnic groups that have very low bone mass and should consider a bone density at or around menopause. And once you have a bone density, many clinicians will follow based on that first baseline approximately every 2 years to see if you've stabilized or whether it's getting lower and one should consider an evaluation and some kind of therapy.